Hey everyone, thanks so much for joining me. My name is Dr. Marinelli. I'm the Director of Advising with Med School Coach, and today we're going to talk about applying to medical school and what extracurricular activities that you need. So we're going to go through several different clinical and volunteer activities that are pretty much essential for any pre-medical students to have when they apply to medical school. I like to break it down into about 5 different categories of things that you really should be looking for and developing as an applicant over years of preparation for when you actually apply to medical school. And extracurricular activities are very different activities in a series of different experiences, and you can kind of classify them into the 5 that I have listed here. And we're going to go through these individually and talk about what makes a great extracurricular activity. And also I wanted to break it down by trying to do a little bit of a case study. And what I mean by that is, as we talk about each one of these categories, I also want to talk about somebody, an applicant that I've worked with or I've seen in the past, that really stood out, that really made this activity unique, and to give you some ideas on how you could possibly do the same thing. So let's start with community service. So community service is obviously a service activity where you are not necessarily getting a reward or compensation. So I like to think of this as something being altruistic, trying to be much altruistic as you possibly can through an activity. And what do I mean by that? That means that you're pretty much doing something for somebody else without getting something in return. So there's lots of different ways you can do this. And I put a couple examples on the page here, but tutoring, camp counselor, volunteering in a homeless shelter, volunteering for Meals on Wheels, things like that. This is where you are actually giving your time to other people without necessarily getting any praise, any experience that's going to necessarily prepare you as a physician, or even getting paid or things like that. This is really just giving your time to help somebody else. And the reason why admissions committees really like to see this is because this is what you're doing as a physician. You're working to give your time to other people. And although as a physician you get compensated, eventually it's still a lot of work. And so medical school admissions committees want to see that you have some altruistic ability and altruistic nature to yourself. One note here is that lots of times people say, well, what if I volunteer at a hospital? Wouldn't that be the same type of thing as community service, as volunteering? I'm not necessarily getting paid or anything in return, but there's a bit of a caveat there, and we'll talk about hospital volunteering more in depth later on in this presentation. But with hospital volunteering, although it's volunteer and not paid, you are getting some benefit from doing that. And that benefit is you're getting hospital experience. You're getting to see what physicians are doing, nurses are doing, working with patients. And so you're getting that exposure to the medical setting, which is really benefits you as a pre-medical student. So community service is trying to be as altruistic as possible. Now let's look at these numbers here. So if you see here that this minimum and average numbers, and I put these on the slides, but I'm going to give a big caveat to these, and we'll talk about that. So there's actually very limited data on how many hours a pre-medical student has when applying to medical schools. And these numbers are actually a study that University of Utah, or some data that University of Utah put out several years ago. And I just use this kind of as a benchmark because they had reported a minimum and then the average. But from reviewing applications and from looking over tons of different applications over the last few years, I would say that these numbers are very, very low. And so I will give you a little bit of a caveat during each of these different sections where I think you should think about for your hours. I think for community service, applying, you should have around 200 hours of community service on your application when applying to medical school. That's where you're going to be most competitive. And we'll talk about hours a little bit more later too, but one thing I do want to note is that a lot of applicants get very, very much caught up in, do I have enough hours? But instead of only focusing on the quantity of the experience, really focus too on the quality. even if you only had 100 hours, but maybe you developed a huge volunteer program and you really contributed to an organization, that could be a little bit more impactful than somebody that spent 200 hours just kind of going to the volunteer organization without really having any impact. So although the quantity is important, make sure you're really paying attention to the quality of the time you're spending. So let's talk about a case study here. So this applicant that I had worked with had gone to Mexico several times and really developed a relationship with the individuals he was volunteering with. He helped build houses and tutored and really made an impact on the community there. And the reason why I use this as a case study is because this experience just really demonstrates his dedication, that longitudinality to it. I mean, he did this for several years, which is great. That's showing medical schools that you're going to be able to commit to something. When you set your mind to it, or you say you're going to commit, you're going to do it. And medical schools like to see that. Another thing is that kind of selfless service, that altruism. I mean, he's not really getting anything out of a trip to Mexico and building a house, except for some hard work. But that's really showing that he just cares for other people and he's willing to put in the extra effort. Okay, so clinical work. So clinical work is super, super important, right? Medical schools want to see that you've spent some time in a healthcare setting, some time talking with patients, and some time interacting with other healthcare professionals so that you have an idea of what you're getting yourself into applying to medical school. So clinical work is key here. You definitely need clinical volunteer work if applying to medical school. And I take that back. It doesn't have to be volunteer work. It can be paid position too, but you should be exposed to physicians, exposed to nurses, other healthcare practitioners. You should try to directly interact with patients as much as possible, so that you have that experience working with patients. So the first time you see a patient in medical school, that's not your first time ever talking to a patient. You at least have some background in that. The numbers here, I think, are very, very low. This is a minimum of 200 hours to be competitive of clinical work. And again, that could be volunteering in a clinical setting, that could be working in a clinical setting or in a doctor's office. It doesn't have to be volunteer or paid, or it doesn't have to be one or the other. It could be a combination of both as well. So this, I thought was a really good example here, is that an applicant volunteered at a local free clinic, and then the applicant really became more involved, more invested, and took on more roles, which I thought that this was really great, because what are these experiences demonstrating? This is demonstrating that the applicant shows initiative and is willing to work with others and really try to take action to provide better care with patients. The other thing that I thought was so great here was that the applicant had a lot of experience just talking to patients and working with them and providing care as much as possible. And that's an important note. I get a lot of pre-medical students that say, well, I'm a pre-med, I don't have any training. So it's really hard for me to get to talk to patients or provide them care. And that is absolutely true. As a pre-medical student, you're probably in college or graduated, you don't have an RN or something like that behind your name to allow you to care for patients. It takes some digging and some time to find these clinical activities where you get up close and personal with patients. Sometimes people do pursue extra training, like they may become a medical assistant or a scribe or an EMT. So they take a few months of specific education, but when they work in a hospital, they're able to provide more direct care because of that training. That is definitely an option, but you don't have to do that if you don't want to. There are other opportunities, but it's on you to really look for these opportunities. It's not going to just land in your lap. Okay, for maybe some people it will land in your lap. Maybe you have a friend, a parent friend who's a doctor and says, come, screen patients in my clinic. More than likely, though, you're going to have to search for different opportunities and different volunteer activities, or working in a hospital where they allow volunteers to really interact with patients and help provide some care. But that's going to take some digging and some looking, but it's certainly worth it to have that on your application to medical school. So research is something that when I applied to medical school, it was kind of just like icing on the cake. Now research is pretty much required. You almost have to have research in order to get accepted to medical school. And what I say is that you need to have research, and then now a publication is really icing on the cake. If you're able to get published in your research, that looks awesome. It's not required, but it looks great. I would say that this is probably the minimum and average here is probably pretty close to what I see for most applicants. Most applicants will have at least been on some research-based project that they've kind of worked through the whole thing and maybe analyzed results and presented them possibly. The minimum, I think, is kind of a little bit inaccurate. You definitely want more than just part of the class. It should be some type of independent research outside of a class. This client that I had worked with was really interesting. He had worked on a very long-term research project, and he actually tested E. coli and from hospitalized patients and their antibiotic susceptibility. And I thought this was so great because not only did he get published on it, he showed that he had dedicated himself to this long-term project. And I thought what was so neat too is that he had some crossover with clinical medicine and then just basic scientific research as he tested E. coli isolates from hospitalized patients. So it had a very direct clinical application. Now, a question I get pretty commonly is, does my research have to be scientific or can it be clinical research? And there's differing opinions here, but I think that medical schools do like to see that you have some bench work science research experience. And the reason being is because in medical school, you're going to take histology and you're going to learn a little bit how to prep slides and look under the microscope and maybe do some pipetting or PCR, kind of basic lab skills. And so you really should have that background, at least in some degree, in order to prepare for medical school. So my argument would be medical schools want to see that. So you should have some of that experience. However, you can have experience too outside of science. So you could have clinical research experience. I know that's science, but I mean with patients, maybe doing drug testing or medical device testing in a clinical only setting. That is definitely something that is really great to get involved with. You get both that kind of scientific process, but then you also get exposure to patients and physicians and their healthcare teams. But you could also do sociology research or something along those lines, as long as you're working through the scientific process of developing a thesis or developing a hypothesis rather, working through it and analyzing results. That's what is really important. But you should have some research experience. Kind of the degree of it, where it starts, where it takes you can vary. But I think, having that basic science research is important, and then you can branch off from there. So leadership is kind of something that's defined in accordance with your other activities. And what I mean by that is that you should have some leadership activity, but it doesn't have to be necessarily different from your other activities. So let's say you were a volunteer coordinator for your hospital volunteer program. That's not a completely separate activity. That is leadership within your hospital volunteer program. Leadership can be separate, of course, but it doesn't have to be. But you should have some experiences where you can really demonstrate your leadership capacity. And why? Well, physicians are usually the leaders in the healthcare team, and having those qualities as a leader is super important for you to be successful in medicine. And the minimum and average here, I think, is pretty accurate. Usually I see most applicants with about one leadership experience. Really top applicants are going to have 3 or more leadership experiences. But this is something you just kind of need to look for. Think about the positions that you currently hold and possibly see if there are ways that you can dig a little bit deeper, take some initiative, and find a leadership position within them. For the case study here is that I thought this was so great is this applicant volunteered at an orphanage in India. And then when she came back, she was just like, I think that we really need to make some change. I can't just go and volunteer there every year. There needs to be some more tangible change being made. So she actually created a profit organizations and raised thousands of dollars and grew that nonprofit organization to go and help the children in India and provide them funds and food and clothes and things like that. And why does that make that so great? But that means, the reason why this was so great is that she really took the initiative. She really thought through a problem, felt the problem, internalized it, and then developed a creative solution to really address it. And, she obviously didn't just do this on her own. She created a team of people that would work at her nonprofit organization. And together they raised thousands of dollars. And so she really showed that ability to kind of lead a team, take them from an idea to a tangible outcome, and collaborate very, very well with all of them. This was a really, really great leadership activity. Obviously, not everybody's going to be able to develop a nonprofit organization, but I just kind of throw this out there because I think it's just an example too of maybe thinking outside of the box. As I said, a leadership activity inside or in part of one of your extracurricular activities is totally fine, but this gives a really great example of somebody kind of taking that one step further and thinking through a problem and really taking initiative on it. So physician shadowing, in addition to your clinical activities, so working with patients and working with the healthcare team, you should have some time just observing a physician and kind of being a fly on the wall in their practice to see what they are doing. One great way to do this and getting some clinical experiences through scribing. Lots of times other people will just go and shadow multiple physicians just to get a taste of what their practice is like. The minimum and average here, I think, are very, very low. I usually tell people about 50 to 100 hours of shadowing is what you want to shoot for to be competitive. Ideally, you want to shadow multiple physicians in multiple different specialties. So, maybe shadowing a family medicine physician, a pediatrician, an obstetrician, a surgeon, things like that. So you can kind of get a sampling of different practices and also specialties. And then also, this is an important note that if you are applying to osteopathic schools, you should really, really shadow an osteopathic physician. Most of schools want you to write about your experience with osteopathy, and saying that you shadowed and worked with a physician of osteopathy is super important for your application there. So the case study that we have here is this applicant. I think he actually had enrolled in a program through his school where he was kind of coordinated to work with and shadow multiple physicians over a series of weeks. And he had shadowed primary care, surgeon, cardiologist, a few other ones, and they were all in various settings. And what made this so ideal is, like I had just said, is that he shadowed multiple physicians. He got those 50 to 100 hours easily. And then he also was with different specialists and in different settings too. So some were in the hospital, some were in a private clinic, some were a combination of both. And so that definitely exposes him to a wide array of medical specialties and their practices, which can really help medical schools get a good idea that you kind of know what you're getting yourself into. You spent time with physicians and you've really seen what they do. So that's very reassuring to medical schools. So that's why his experience was so ideal. Also, I thought it was ideal is because he shadowed these physicians for a long period of time. And so hopefully, he built enough rapport and developed a relationship with them that they could potentially write him a letter of recommendation, which would be super helpful for his application. So those are kind of the 5 core extracurricular activities that I had introduced, and we talked through them. There are other extracurricular activities that I see people do and have on their application pretty commonly. They are maybe not the core ones that you absolutely need to have, but they are activities that do look good on your application. So let's talk about those for a few minutes. So one is international volunteer work or international travel, studying abroad. I think personally that traveling internationally is great. It really helps develop you as a person, and your perspective and your context allows you to see and experience other cultures different from your own. And this can be super, super valuable as a future physician. So I highly encourage it, even just from the personal aspect. But from a medical school admission standpoint, AdComs really want to see this because of those reasons. They want to see that you're not just in your own little bubble of your world, that you've been exposed to other people and to other cultures, and you have a bit greater perspective than just what's in front of you. It also helps too, because lots of times on some of these medical mission trips or medical international volunteer trips, is that applicants will actually get involved, exposed to different medical systems, which is nice to have that perspective as a future medical student, to see what healthcare is like, not only in the United States, but also to see what it's like abroad. So I highly encourage these trips, but you know, it can be hard for some people to afford these, to find these. It is a limited availability. So if you have the opportunity, I would seize it. Talk to your school, talk to churches, family, friends. Lots of times people have family, friends that maybe go every year to a certain country and provide medical care, or a church does similar things. I would try to get involved in these organizations if you can, and this is something at your disposal. Definitely take advantage of it. So another thing that, you know, people kind of find themselves in regards to extracurricular activities is, what do they do during a gap year? So a gap year is, for those of you who don't know, people that want to matriculate into medical school straight from undergrad will apply their junior year of undergrad. The application takes about a year, and then they start the fall of their after their senior year of undergrad. If you apply your senior year or thereafter, you have something called a gap year, where that means you have time off between undergrad and medical school. Tons of people take gap years. It's becoming increasingly common. And sometimes I think it's a very good thing for specific applicants to have that time in between college and medical school. If you're kind of wondering what a gap year is, if a gap year is right for you, definitely reach out to us. We can talk through your application and help you determine if this is the right step for you to be taking. But if you are in a gap year or you're already planning one, some things to be thinking about in regards to extracurricular activities is trying to stay active in whatever current volunteer work you are doing. So it shows that longitudinality, that commitment to that volunteer work. Just because you stop college doesn't mean you need to stop volunteering at the hospital. Showing that you continue that activity is going to look really good. This is a discussion for another day, but if you maybe didn't have a good GPA, or you need to finish prereqs, then an activity during that time would be continuing education through a post-bac or a special master's program or something. In addition, if you're working, or if you're completely out of school and you need to have a position that actually pays, then some things to be thinking about are like a medical scribe, an EMT, doing some clinical research. Oftentimes you can find these positions that are paid, that are taking college level graduates, so that you can continue to kind of get exposure to the medical field, but then also kind of double dip by getting paid and supporting yourself. Whatever you do during this time, try to make it worthwhile. Think of activities that are going to build up your application. I always make the joke of somebody that's in a gap year and all they do is work at Chick-fil-A for the year and binge Netflix. That's not going to look very good on your application. However, that same person, if they're working as a clinical research coordinator and continuing to volunteer at the hospital, and they could binge watch Netflix at the same time on their free time, that's going to look good on your medical school application. You're going to show medical schools that you're dedicated to the path of medicine. You're doing something related to medicine, where you're continuing to get those skills working with patients, getting exposed to the healthcare setting and learning there, and also continuing your commitment to your volunteer activity. that is what's going to make an impact and really show strength during the gap year, rather than using the gap year that could potentially hurt you if you're not contributing to your application. An applicant that really stays in activities that are contributing to their application is going to help, and that's going to help them get ahead as well. So as we kind of talked about, what makes those best extracurricular activities? Not only do you need to have this kind of numerical quantity of extracurricular activities like we talked about, but how do you make them unique? How do you really make them stand out? And these are some things that we kind of talked about, but think about having that continual longitudinal commitment. If you started a volunteer activity in freshman year of college and you like it, and you continue it through senior year, great, keep going with it. That shows that you have the dedication to something. Medical school and becoming a physician is a long journey. So if you can show medical schools that you can really dedicate yourself to something early on, that is reassuring to them that you're gonna make it through medical school and residency and all of the training to become a physician. We talked about this, but trying to have as direct as much as possible patient care. So working with patients and talking with them and interacting with them. That icing on the cake of having a research project that actually produces a paper or a presentation really just makes that stand out and shows, again, your kind of extra level of commitment to the project. Getting a letter of recommendation from an activity, I mean, that kind of not only solidifies when you write about the activity and you say, like I did X, Y, and Z, and I showed my dedication through this and this and this, the letter of recommendation really kind of, you did all these things through an activity and you learned this, and then maybe the supervisor of that activity writes a letter that reinforces all that. That really helps medical schools understand that this was a very impactful activity and you really dedicated yourself to it. The other thing too is passion. Do what you want to do. I know that we have those core extracurricular activities, but if you find yourself in a volunteer position that is just boring, or you just do not feel like you are actually interacting, or you're not getting, to really put yourself out there and learn and grow as a person from it, don't continue with it. Go on to something bigger and better. Find activities that are going to make you happy and enrich you. Try not just to use the activity to check off that imaginary box on the medical school application. Try to actually do activities that are important to you and matter to you. And that kind of goes through to this next point, is that you're going to have to write about your extracurricular activities during your AMCAS application, which is your primary application. You will talk about them during your medical school interview. So, even though you're going to be classifying your activities on your AMCAS application as either volunteer, clinical experience, shadowing, et cetera, it's not like you need to check all 5 of those boxes like I had those 5 core extracurricular activities. You're going to want to have a wide array of activities, but just putting something there to just say that I had clinical experience is really, really going to be detrimental to your application. The reason being is because if you didn't enjoy it, if you didn't have passion for it, that's going to come through on the way you write about it and the way you talk about it during your interview. Medical schools are going to be able to discern that this wasn't that important to you. This was just something you did to check off the box. So instead, as I said, make sure you're passionate about it, you care about it, and that's going to really shine through in those essays and your interviews. And medical schools are going to really be able to see that this was something that you cared about and that you put your all into it. So thanks so much for listening to this. Definitely feel free to reach out to med school coach about any questions you have. Lots of times we get people that sign up for an hour to talk with one of our physician advisors that have served on admissions committees, just to kind of go over their extracurricular activities, the things that they've done, and maybe make plans for the following year based on what they have done and what they need to do. And that is a great way to kind of make sure you're on the right track and that you're developing yourself appropriately as an applicant. So definitely consider reaching out to us and having that conversation so we can put you on that right path and make recommendations for your extracurricular activities so that you're competitive as much as possible when you're ready to apply. Thank you again for listening to me. I hope that was helpful. Stay tuned because we're going to have a really awesome question and answer session. And so hopefully some of these questions that have come up while I presented this, I'll get to them, we can answer them, and kind of talk through some of the common questions and maybe some of your specific situational questions as well. Thank you. Hello, everyone. Thanks so much for listening to that presentation. Hopefully that was helpful, and I've been trying to answer some questions along the way as I've seen them come up, but I definitely want to talk live about some of these more common questions that we're getting asked a lot of. And a lot of these questions too, we get asked these even during non-pandemic times, so definitely want to be able to cover a lot of these. Dr. Lipset is also going to be joining me for the Q&A session. There he is. Hi, Dr. Lipset. Dr. Lipset is one of med school coaches' absolutely greatest advisors we have out there. He has tons of admissions committee experience, has worked with tons of applicants, and he is a retired radiologist. So his input is incredibly valuable. So I invited him to join today so that we could answer some of these really important questions that have been thrown around out here. Dr. Lipset, I'm going to throw one out to you that I see a lot of people asking, and I know as advisors, we've talked about this. What should people be thinking about right now for extracurricular activities during the pandemic?
Well, first of all, thanks for inviting me to participate, and I wish everyone the best of luck. That's a question on everybody's mind. It's very difficult. I think this really forces people to be very creative, and it's very locale oriented. In other words, you really have to investigate what's available within your community. If you're on campus, if you're as an undergraduate, there may be opportunities for you, even though they may be online opportunities, not physically on campus. If you're in a gap year, you're going to have to really be creative. You have to look around what's available in your community. I was thinking about this, and my thinking also is that with kids returning to school, but to a large extent it's online. I know that parents are concerned, teachers are concerned how this is going to translate in terms of their education. There probably are tutoring opportunities, educational opportunities, I think, that people can become involved and take advantage of. I think, unfortunately, you have to look basically for online opportunities. Some of the classic or standard opportunities, which would be perhaps a soup kitchen in your community or working in a senior citizens home, the old standbys, those may not be available, unfortunately. So I think it's very much area specific.
Yeah, definitely. And it has been really difficult, but I've seen a lot of applicants this year get creative. Like you're saying, a lot of people are doing things virtual because that's kind of what this whole world has turned into, at least for the last several months, is virtual things. So I've seen, virtual mentorship, virtual reading to impoverished students, all kinds of things. And I've seen a lot of also people writing about virtual shadowing programs. And as you said, that's going to be definitely area specific. But I think what's important to note is in a COVID era right now, maybe, virtual shadowing is the best thing you can get. Probably not ideal, right? I mean, I think it would be much better to have you be live in person so you can talk with the doctor, interact with the doctor and the patient. But if virtual shadowing is all you can get right now, I would say go for it and try to get that.
And the COVID pandemic right now, I mean, it affects everyone. So to some extent, everybody's in the same boat. I think it's really those who are the most creative and also really try to plan ahead. They'll do the best.
Mm-hmm. Yeah, absolutely. And I think the other question that we're getting a lot of too is, people kind of worried about, well, is this going to be okay when I apply to medical school in 2 years? What are medical schools going to think about, my online volunteer work? Well, I mean, no one's going to, well, I wouldn't say no one, but most people are not going to forget these circumstances. And so
Right.
medical schools have already talked about during this current cycle, and obviously during subsequent cycles, they're going to take this into account and realize that for this year or however long this pandemic lasts, opportunities are going to be very limited. I think the key, though, Dr. Lipset, and I wonder if you'd agree with me, is the key is just not to do nothing. I think that the key is to really show medical schools that you're staying active in something. And so maybe it is just, maybe you limit your volunteer activities. Maybe you went from like 10 live activities to maybe 2 virtual activities because of COVID. But I still think the key there is to continue doing something. I think they'll take it into account in context of the pandemic. But if you do nothing during this whole pandemic, I think that could be viewed pretty poorly on your
Right.
application.
Well, one other thing that people can do, and that is, anticipate that in the future, at some point, of course, hopefully, things will clear up, and you can try to anticipate, try to line up some future activities. So when the coast is clear, hopefully sooner rather than later, but when it is, then maybe they can take advantage of some of these opportunities, and not delay. So lining it up ahead of time might be a good idea.
Mm-hmm. Yeah, absolutely. And I think that's a great point too, because like once things actually go back to normal and you can start getting live, there's going to be a lot of people that are going to
Right.
want to get into these shadowing clinical volunteers. And there's already a lot of people that are already trying for those positions. So trying to line that stuff up early now, I think that's incredibly important. Another question, moving aside from the pandemic, and I know that's a very important question. I don't want to minimize it because so many people have asked about it, and it's on everyone's mind right now. Dr. Lipset, I've gotten a lot of questions about people wondering kind of what is the time frame of my extracurricular activities, and this has been asked in various different ways. High school activities okay, or if I took like a few gap years, activities 5 years okay. What is that timeline for admissions?
Well, I think that the activities, that's the one area where you really, really do have to plan ahead. And I love meeting with applicants a few years, in fact, before they actually plan on applying to medical school, because many of these activities you almost have to cultivate them. They're not last minute decisions.
Yeah.
Now, I think that as a general rule, unless something is truly fundamentally transformative, usually high school activities are not considered unless it's a carryover and it's something that you continue to participate in as an undergraduate or maybe during gap time. So if the
Mhm.
genesis is during high school,
Yeah.
maybe that's something that could be used. But as a general rule, no, we tend to use activities that have occurred during the undergraduate years or during gap time. And let me just underscore what you said earlier. Um, Gap time can be a great thing, but only if it's useful and productive.
Mhm.
And many times, activities that are begun as an undergraduate are carried over into gap time, and that's a great thing too. But as a general rule, high school activities are usually not included in the activities list.
Yeah, I totally agree. And every once in a while, like you said, there's exceptions, like the genesis of the activity in high school, or maybe somebody, graduated college in 2 years. Well, they didn't have a lot of time to do any other activities. The other thing too, I've seen a couple very, very rare circumstances of like some really, really exceptional high school activities. Like I had one applicant that I worked with that did some huge project with NASA and sent some satellite up into space. And I'm like, whoa, that's insane. You know, it was pretty significant. So I said, include that because it's just so out of the box and exceptional, but those are pretty far and few between. Most people in high school are going to have shadowing or maybe some hospital volunteer work or something like that. So I would say those types of activities should not be included, as you said. Let's talk about another question that gets commonly asked, and people are asking it right now too, is research. So Dr. Lipsett, can you speak to kind of the different research activities you've seen? What do you think is valuable for admissions? And kind of, we can talk about even segueing in, how do you get those volunteer activities or research activities?
Well, you know, you have to ask yourself the question, why is research considered so important? And I think it's for a couple of reasons. First of all, the ability to engage in research, aside from the problem solving, of course, and the discipline that you display, but it also demonstrates that you can collaborate. And in medicine, you never go it alone. And the ability to work in a team setting, to play well with others, that's really very important. And you can say that you're good at collaboration. You could say that you enjoy participating in projects. That's fine. But when you've actually demonstrated it through research, that says a lot about you. Now, I think research, as you mentioned earlier, it can be basic science research, but there are also many very worthy and interesting clinical research projects that I think enhance, an application. And then there's also the practical consideration. The fact is that often there are researchers on the committees. So, we could debate or discuss how significant research experience should be. But the fact of the matter is, it is very important. And I've witnessed very worthy candidates with great metrics, unfortunately, not be successful in the application process because they lack research, with committees basically saying, come back next year, but show us that you have some research under your belt, and it demonstrates that you can collaborate, and you can problem solve, and you can work with others. So it really is important.
Yeah, absolutely. And so I totally agree. And I feel in the last several years, research has become even more critical for the application. I mean, I think, maybe 10 years ago, people could apply without a research experience and still have a pretty good chance of getting in. But now it's, as you said, it's pretty much something you absolutely have to have.
Right. And one other thing.
Go ahead.
Well, one other thing I just wanted to add, and this is part of the planning ahead, when you're on campus, while you're part of an institution, there are so many opportunities, hopefully, that you can tap into. But I find that individuals, if they have no research background and they've gone on into the real world, and they're maybe experiencing gap time or maybe even a career change, so they're years away from the undergraduate experience, they have a hard time finding research opportunities for themselves. So what I would urge is that take advantage of the fact that you're in a university setting, you're on a campus, and investigate research opportunities.
So it sounds like we were still kind of touching on, we went from research over to kind of shadowing and getting some experience in clinical medicine. Right.
So yeah, hopefully that answered the question. And again, it's during these times, it's particularly difficult to get shadowing experience. However, maintaining contact with clinicians, even if it's virtually, even if it's online, anything that you can do to, again, demonstrate that you have a significant amount of medical experience. And I have to tell you, I mean, I have worked with just outstanding applicants, very bright, great metrics, but with minimal clinical exposure. And you just have to wonder to yourself. And by the way, I was sure that having talked with them, that they knew what they were doing and getting themselves into. You have to remember, you're dealing with a committee, and you're dealing basically with strangers, and you're trying to motivate them. And when you go for an interview, you're trying to get somebody to advocate for you. And one of the ways of doing that is showing, look what I've accomplished, and I don't have to worry about me. Making this career choice is the right fit.
Hmm. Yeah, absolutely. Great point. Let's answer maybe some of these more specific um, questions. I know we were trying to generalize, but some people have pretty specific questions on some of their extracurricular activities. And let's see, one of the questions that I've been seeing a lot is what is considered longitudinal or a long commitment? And I think that's probably a little bit different for everybody in every activity. But when you're looking at applications, Dr. Lipson, you see an activity, where is that? I mean, I don't think I have a perfect number in my head, but where do you see that kind of commitment time where you're like, wow, that's really great. They spent a lot of time and a lot of effort on this extracurricular activity.
Yeah, again, you're right. That's a tough one to answer, but I look at two things. I look at, of course, the number of hours, but I also look at over how long a period of time. And when I see somebody who's devoted 6 months or a year or more to an activity, let's say they've been actively involved in some sort of society, or maybe they've created some sort of activity. It could be considered leadership. But when I see that they have been doing this for several years, or perhaps something, a volunteer activity like working in a soup kitchen, it's not one and done. But I'm seeing this person every
Mhm.
Thursday night for a year or maybe more, then I know that they're committed. And I know that they've developed relationships, and this is a substantial activity. So there's no single answer, but I think it is a combination of duration of time and the number of hours. And I think when you put those two together, you can pretty much sort out which activities are really substantial and the individual has made a commitment. Um, but it's on an individual basis.
Yeah, I totally agree. And I do the same thing. I look at hours, but then I also look at that time frame. Like even for people that maybe have 300 hours and then it's only a month or 2 months, you're kind of like,
Right.
well, how significant was that activity? Usually that would be like a summer activity or
Right.
something. Maybe they spent a couple months, at a summer camp or summer research project. I think kind of those ongoing longitudinal activities where they've spent 300 hours, but it's been over the period of 2 years. So that means that they've formed relationships with their mentors. They've formed that collaborative environment that we want to see emulated one day in medical school. I think that's a little bit more telling than just these kind of one-off volunteer activities that may be
Mhm.
significant in hours, but maybe the experience wasn't as significant or impactful to the growth of that person.
Sure. And I should also add, especially in terms of planning ahead, that at least for the AMCAS application, three activities are going to be you're going to have to designate three activities as most meaningful,
Mhm.
and they really need to be meaningful. And for that to happen, it has to show a long-term commitment. Sometimes people make the mistake of taking a relatively short-term activity, limited hours over a brief period of time, and that becomes most meaningful. Now, I
Mhm.
understand that that can happen. I get it. But as a general rule, you want something for your most meaningful activities that's really, as you said, longitudinal, where the time and the effort are apparent. And those are the types of activities you want to use. And you have to
Mhm.
plan ahead because you need three of them.
Mhm. Yeah, absolutely. One question I just saw that I thought was a really interesting question, I thought this would be fun to answer is what qualities would you like to see in emerging doctors and medical students?
Okay, well, so here's a little exercise that I play, especially at the time of an interview prep. And I ask the applicant, what would you be looking for in a physician? If, let's say, you had to find one for yourself, you had to recommend one to a family member, what makes the ideal physician? What qualities and characteristics? And the reason why that's a very important question is because that that's really the essence of, I think, what what is being looked for in an application. Now, I think in terms of the process, stepwise, the first thing is the metrics. And one of the reasons for that, of course, is because many of these schools are getting 8, 9, 10,000 applications, 14,000 for Geffen, 14,000 for Georgetown. It's an impossible number of applications. So the initial screen does tend to be ruthless, rather ruthless, whether it's an algorithm or whether it's an incredible committee effort. But they're going to distill this massive applications to a manageable number, which maybe it'll be a couple of thousand, and they'll use metrics for that basically. But once you get past that point, once you get your foot in the door, my belief is it's the activities list, because it says so much about you. And sometimes people will say, or an actor will say, what do they want from me? What do they want? And I go, look at your application. It's an open book test. And if you look at the activity categories, they're crucial. Okay, volunteer work, are you altruistic? Medically related activities, can you work with doctors and patients? Do you know what you're getting yourself into? Research, that's collaboration. Teaching, are you an educator? Because we don't do paternalistic medicine anymore, right? Fortunately, I'm the doctor, you're the patient, I read the textbook, do what I tell you. We talk about empowering, we talk about partnering. You don't ask anybody to do something they don't understand. So you're educating. And I'm not talking about necessarily being in academics or in a university setting. I mean, you could be at a little clinic somewhere with a single patient across an exam table, and you're teaching and you're educating. So they ask about that. They want to know about leadership. You're going to look, everybody in the healthcare team is important, of course, but somebody's got to lead, and usually it is the physician. They want excellence. Do you have honors, publications that you can talk about? Extracurricular activities, which really demonstrates the diversity, the talents that you bring, and also the fact that you can embrace diversity. I think it says something, something about that. So, all of these activities have a purpose. And it's the categories, I think, that are important, that are really key. And people should address these. So again, just to summarize, if you want to know what they're looking for, look at your application.
Absolutely. That's a great answer. Thank you. We are coming up right at the top of the hour here. It is 6 o'clock Pacific time where I'm at, and 9 o'clock Eastern time where Dr. Lipset is. So we are going to be wrapping up. But, I know you probably have a ton of questions out there. Reach out to us at Med School Coach. We can definitely help you with your specific situations. Not everybody is a cookie cutter medical school applicant, and nor should you be. Everybody's situation is different. Everybody has different circumstances that allow them to participate in a ton of extracurricular activities or none at all. So talk to us, and we can definitely kind of sift through what you've done and make recommendations for you on how to improve and what you can do better, and just help you through this whole crazy process of applying to medical school. Dr. Lipset, any closing thoughts?
Well, I just wish everybody luck, of course, in this application process. It can be somewhat perplexing and complex, and that's why having some guidance is always helpful, dealing with people who are experienced in this. And I guess the bottom line, though, is to plan ahead, be prepared, and understand that it's a longitudinal process. It truly is. And I wish everyone the best of luck, and thank you for letting me participate.
Well said. Thank you so much for joining us tonight, Dr. Lipset. Everybody out there, thanks so much for listening. Hopefully this was helpful, and everybody, good luck and stay safe.